my name is Gina Gray and I'm gonna do the tracheostomy care video. Just for the purposes of this video, I have a low working space, so I'm just gonna use a chair. So when I stand up. Okay, so for a tracheostomy care, we will need a provider's order for that and make sure that that we have the right patient, that we verify and with two patient identifier, and we understand why the patient is getting a tracheostomy care. And when we go to the patient's room, we want to provide privacy. We want to introduce ourselves. We want to do the hand hygiene, and like I said, the two patient identifier for this patient, right? And before we do anything, after our confirmation, the most important thing that we need to do for this patient is do an assessment, and so we could have a baseline of what their current status is. We want to check their cardio and pulmonary vital signs. We want to put on an oximeter for the entire procedure for this patient, because we'll be removing the oxygen source. So we want to see if the patient is tolerating the treatment or not by having that oximeter on. Okay, so the most important thing, have that assessment done, and then have do some secretion if we hear from our lung lung assessment. If the patient is having secretions, you want to do a suction before we do the tracheostomy care. So suction if needed for the patient. Okay, so then we explain to the patient why we're doing a tracheostomy, how long the tracheostomy is gonna be. We want to allow them to ask questions, and then we want to let them know how to state that they're being in pain, they have discomfort, by raising one of their hands in case that they cannot talk. So for this patient, we want to elevate the height of the bed for the working space, and we want to put the patient in a semi-Fowler or Fowler's position. Gotta be like 30 degrees at least, in order for us to do the tracheostomy care. And then we are going to pre-oxygenate this patient for about 30 seconds to 1 minute. So we pre-oxygenate the patient in case, so they have the oxygen cushion while we do the treatment. Okay, and for the purposes of this video, I have clean gloves over here, my trach kit. This is going to be my sterile normal saline, and then this one over here is going to be the hydrogen peroxide. We have the patient who has a tracheostomy over here. Okay, so the patient is I have the patient all the bed raised up and then in a semi-Fowler's position. So I'm gonna do the hand hygiene. The patient is ready. He is aware of what the situation is. He knows what to do. We already pre-oxygenated the patient. So now we're gonna start the cleaning of the tracheostomy, hand hygiene, and then we put on our gloves. So I'm gonna be removing the oxygen source from the patient. Remove the oxygen source, and then I'm gonna remove the soil dressing. Okay, after removing the soil dressing, you wanna discard it with the gloves. Okay, do hand hygiene. Okay, and now we're gonna be opening our sterile kit, the tracheostomy kit. We wanna open it away from us. this is my sterile gloves. I'm gonna just set it aside here. And then I'm going to be picking up the white chalk. And you can only touch the shiny part. There's a fold, and then a 1-inch border. There's a fold here. I'm just gonna grab it, and then it's gonna open up. Okay, only touch the 1-inch, and we're gonna set it aside here. And this is gonna be our sterile field. I'm just gonna open my before I put on sterile gloves, let me dump the content of the kit onto the field. Okay, and then for all of this, we're gonna put the sterile normal saline. There's like 3 containers here. We put the normal saline, and then for one of them, the soaking solution I'm gonna put on the back is with normal sterile normal saline and hydrogen peroxide. So that's gonna be a 1-to-1 solution over there for our soaking solution. Okay, and now I'm gonna put on my sterile gloves. Okay, I'm gonna go ahead and pick it up, and then I'm gonna put my hand and then slide. I like to pull from the back because sometimes the gloves roll on me. Okay, so once you have your gloves, you gotta get the other side. You gotta pick it up from under the cuff, and then insert your hand. Okay, it's the same thing for this one. Just be careful not to roll the back. Okay, just gotta keep the hands above the waist with the sterile gloves. I'm gonna go ahead and reorganize my kit. So I have some gauze, some 4x4, the specific gauze. I have a laces brush, and then I have sterile applicators that I'm gonna be putting in one of the saline solution for later, so they're gonna be there. Okay, now that we all have that set up, what we want to do is I'm going to unlock and remove the inner cannula, and I'm gonna take it out along the curve, along its natural curve. So you unlock, and then you're gonna remove along the natural curve. Okay, and then what we're gonna do is we're gonna put it in the soaking solution with the hydrogen peroxide mixture. We're gonna go ahead and grab our brush and clean it up. So I'm gonna clean it up of the secretions and crust. Okay, after that, we're gonna rinse it in normal saline over here. We're gonna discard this brush. Okay, after we rinse it and it's all dried up, we're gonna be putting it back. Be careful. Okay, the same in the inner, the same curve for the patient. So now that we've done that, we're gonna go ahead and clean around the stomach area, behind the flanges, the faceplate. So that's what we're gonna do. I'm gonna go ahead and get my sterile applicator and clean outward around the stoma, and then discard it. Clean outward around the stoma. I'm gonna clean on the face plate. I'm gonna clean behind the flanges. Okay, now that it's all cleaned up, what you want to do is you want to pat dry the area. So how we're gonna do that is we're gonna use the 4x4 gauze, and we're gonna be patting dry the area and discard it. Okay, so we want the area to be pat dry so that the patient won't have any skin irritation if it's still damp and a little wet, and it also can cause bacterial infection, can also cause infection. Okay, so now that we clean the area, what we're gonna do next is we're going to change the tie of the tracheostomy. So in order to change this, I would need to ask for assistance. One person is going to be holding and stabilizing the tracheostomy while the ties are being changed. So for today's purposes, we don't have an assistant, so we're just gonna do it on our own. We're gonna be stabilizing it with one hand, and then the other hand is gonna remove the tie. So you stabilize it, you remove the tie, okay, and then you're gonna discard it, and then you have to get the new tie. So we're gonna get the new tie. Okay, and then when you put it around the patient's neck, make sure that the tie has no twists or turns. Okay, and then we're gonna secure it onto the other end, and we're gonna do a tie. Okay, so once it's tied, just make sure that it is loose. I mean, it's tight enough, but you can still put about 2 finger widths inside. Make sure it's snug but not too tight. Okay, now that's done, we're gonna be putting the gauze We're gonna put it around this area. Okay, now that's been put, we're gonna be also using a 4x4 gauze, a folded 4x4, and we're gonna put it on the knot area. And this is for the patient's comfort, so he doesn't feel those knots and long ties around this area. Okay. And we're just gonna put a tape on that gauze, not on the skin. Okay, and once you're done with that, you can go ahead and let the patient know that you're done. We're gonna be discarding all of our trash. Okay, we're gonna, and then we're going to put the patient's oxygen back. So we're gonna put back, we're gonna replace the oxygen source to the patient so that the patient is you know, able to get that oxygen again. And then we're gonna lower the bed all the way down, and we're gonna give the call light, make sure the call light is within reach, and ask the patient if this is the position that they want to be in. And we're gonna go ahead and remove our gloves. We're gonna hand sanitize. Okay, and we're gonna keep asking questions to the patient, if they have anything they want to say, give them the comfort that they need. And the call light is within reach, make sure the patient's safe. And we're gonna be after, you know, hand sanitize, we're gonna be documenting the process. And that's it for the tracheostomy care video. Thank you.